Today's topic is about EMS and Civil Protection Services cooperation. In emergency management, emergency services and civil protection may operate jointly or separately, depending on the situation. Despite their differences, both are essential to delivering effective response to any type of emergency. What seems clear is that EMS and civil protection services working in a synergic way can provide a coordinated, efficient, and multidisciplinary response to emergency situations or disasters. Today, we will explore different models in Europe. We have speakers from Spain, from Germany, and from Italy, who will present different ways of coordination between EMS and civil protection services. In the benefit of time, I would kindly ask you to post your questions in the Q&A function to be addressed by the end of the webinar. Before we start listening to the speakers, I would like to give the floor to Lisa Meyer from Johanniter, which is the organization leader of the administrative part of the project. And Lisa will briefly introduce the KnowEMS project. Lisa, over to you.
Thank you, Paloma. I hope you can see the right screen. Can you?
Yes.
Perfect. So thank you on behalf of the KnowEMS consortium. I would like to briefly introduce the KnowEMS project to all persons that are joining the webinar for the first time today, and I will try to keep it short. So KnowEMS is the abbreviation of Knowledge Network of Workable Emergency Medical Systems, and it is a project co-funded by the European Union. KnowEMS started in January 2025, and it will be completed in December of this year. The consortium behind the project consists out of 7 organizations representing 6 different countries. Here we have Johanniter Unfallhilfe e.V. In Germany, we have Magen David Adom from Israel, the National Institute of Medical Emergency in Portugal, the Department for Emergency Situations within the Romanian Ministry of Internal Affairs. We have Ayuntamiento de Madrid from Spain, the Société Française de Médecine des Catastrophes from France, and Assistance Publique Hôpital de Paris, also from France. KnowEMS builds up on a further project called No Fear, in which it has been identified that there is nearly no network existing for emergency medical services to exchange knowledge on a national level. During COVID, for example, this was a great challenge. To mention just one example, as you all probably remember very well, the pandemic has had a different level in the various countries at the same time. So the access to already existing knowledge and lessons observed on different measures could probably have helped to overcome this pandemic a little bit more easy. If you are also interested in the No Fear project, we will put the link in the chat to visit the website when I'm done with speaking. In the KnowEMS, we are now creating a network of EMS operation managers with involvement of civil protection and public safety actors also. And we are organizing monthly webinars to discuss topics of interest to give EMS staff and EMS operation managers the opportunity to learn from each other and from the experience they already experienced. Therefore, we invite presenters from organizations and authorities all over Europe and also beyond to share very specific experience. Also, we share the knowledge accumulated in the KnowEMS sessions through the knowledge network of the EU Civil Protection Mechanism and through other fora with the public. We are recording the webinars, so if you missed any of the previous sessions or if you would like to review them, please check out our YouTube channel where you can find the recordings. Last but not least, if you don't want to miss anything, become part of our network, if not already done, and register via this QR code if you are quick. Otherwise, I will also add it to the chat. And for those of you who would like to receive a certificate of attendance for this webinar, please stay with us with the last speaker, we will share the QR code as well as the link in the chat where you can register to get one. With this being said, I would like to hand back to you, Paloma. Thank you.
Okay, let's go start with the speakers. Our first speaker is Reinhold Erdt. He is head of unit civil protection at German Red Cross. He has a background in humanitarian work with duty station in Greece, Belgium, France, and Morocco. So Reinhold, the floor is yours.
Right. Thank you very much. I hope everybody can hear me well.
Yes.
Well, thank you also for the chance of presenting here today. I'm stepping in for a colleague, but I'm very happy to be here and hope that you will take something meaningful and interesting from this presentation. I am here to present about a pilot project that a group of civil society actors are building up together, which is called in German Mobiles Betreuungsmodul 5000, which is the federal government civil protection reserve. And I won't keep you too much with the legal background of how civil protection in general works in Germany, but it is important to note that there's two different areas. The first one is disasters related to natural causes. These are the responsibility of the federal state. So what you see on the right side, daily emergencies, disaster control, accidents, these kind of things. These are within the federal system, the responsibility of the federal actors. Whereas on the other hand, you have everything that falls under armed conflict, war, defense. These are then the responsibilities of the federal government itself. So we have in Germany this differentiation, which is necessary to just mention, because what the organizations that work in this project and that I work for are doing is we work in both of these areas. But this project that I'm going to talk about is the responsibility of the federal government and falls under everything that is related to the possibility of an armed conflict, something that unfortunately, as we are seeing now, is becoming more and more well, it's a reality in some parts of Europe, and it's becoming more and more a reality in others as well. So what hides behind this mobile care reserve of the federal government? The objective is clear. So we want to have a resource that enables us to help people in need and to implement a response that ensures the survival of people that are unharmed by the effects of war in the event of tension and defense. So the idea is that basically there's a big stockpile of items that is somewhere in the warehouse, and then in the case of a need, a potential conflict, something like that, where there's a big movement of people within Germany, that we can basically support these people on the move with the needs they have. And so the third one that I mentioned here is the targeted management of refugee flows. So this is the idea that we can have a module that can house up to 5,000 people and basically enable them to have a place to rest up, and then move on from there. And so within this objective, this whole module that we are developing is basically tasked to provide everything that's necessary when it comes to shelter, logistics, food, non-food items, energy, water, wastewater, trash. So basically everything that you would need to care for these 5,000 people. The project itself, the project itself is now in this pilot phase. So the idea is that we have a concept, we develop it, we procure all the necessary items, we try it out, we have different kind of scenarios where we see how it works, and then basically develop it further and build more of these units. So each unit is thought to care for and house up to 5,000 people at any given moment at the same time. And basically then with multiple of these support modules, we would then be able to enlarge this number. What you can see here is a bit of a timeline. So at the moment we started in April of 2020, and that's since then I'm part of this project. We will come to an end at the end of next year with our first pilot project, and which is developed by the German Red Cross, but in close collaboration with the other civil protection actors, which are Arbeiter-Samariter-Bund, Deutsche Lebensrettungsgesellschaft, Johanniter Unfallhilfe, and the Malteser Hilfsdienst. So within these 5 organizations, we have all the knowledge we need to build this module up and to develop it. At the same time, there's now a second module being financed and procured, which is basically a mirror of the first one. So whatever we now developed conceptually can also be procured in the second module. So in the hopes that there will be further modules in the future, we are now able to basically have 5,000 in the first pilot phase, and then another 5,000 in the second module. Big advantage of this module is that basically this number of 5,000 can be combined with different modules, can be enlarged, can be shrunken down a bit, so it can be used flexible, standalone, or combined to respond to a wide range of different scenarios that are possible. But again, as I said in the beginning, the idea is that we are responding to large movements of people within Germany and to be able to cover their basic needs. What we've seen during this first pilot phase is that since 2020, we had different scenarios that were not the scenario of an armed conflict, but still we had, for example, natural disasters, the floodings in the Ahr Valley in Germany, where also parts of this module have been deployed. So there is more scenarios are possible, and we have basically now this knowledge, and we build it into this pilot project to evaluate if the things that we conceptually thought about and that we designed and procured are working. But so far, we're on a good track. But again, the main reason of this is to be able to procure, like to care for people on the move, so that they have the services they need. And yeah, there's a specific background to this. As I said, we are thinking about armed conflict scenario. So we are thinking about large destruction of infrastructure, maybe also a longer period of time that this needs to be deployed. We are not quite sure how these scenarios might develop. So these are the requirements that are basically the basis for the development. As I said, the basic needs need to be met. All the necessary materials need to be procured and stored in one location to be able to cater for the need for 5,000 people. All the material needs to be able to be deployed and then be as resilient to be deployed for up to 1 year. We are supposed to work largely self-sufficient. What does it mean? That means that we basically need to be able to produce our own drinking water. We need to be able to deal with our own wastewater. We are producing the electricity. So self-sufficiency within brackets, obviously, as we all know, if you want to have electricity, you need a generator. A generator needs some kind of fuel. So self-sufficiency in a sense, but the idea is clear that this needs to be deployed or deployable. For example, if there's a green field, we need to bring everything so that it works for these up to 5,000 people at a time. We need to do it quickly, and we need to do it modularly. So we basically 72 hours for the first mobilization phase, and then we need to move on to basically build it up to be able to quickly accommodate up to these 5,000 people. Besides the idea of deploying it as one module, there's the idea of deploying parts of it to support existing facilities. So for example, What we did in this flooding in the Ahr, there was a hospital where there was the power cut, infrastructure was destroyed. We were able to basically deploy the energy module of our support module and then have enough electricity for this hospital to continue running. So these are elements that we try to develop so that we can have this potential support for existing facilities, because the full deployment obviously is very logistically challenging, but it might be necessary. So we also need to think about the independent deployment of this whole module, and then even think a step ahead and also think about the deployment of multiple of these modules for 5,000 people to respond to this potential big influx of people that have lost their home and are now moving around in Germany. So what kind of things do we cover? I briefly mentioned it already. There is a logistics component to basically mobilize all of it. So we have trucks, we have vehicles. There's also all kinds of vehicles to deploy then in the location to build up all the containers that we have, all the tents that we need to build. So we have small tents, we have big tents. There's everything that we need for the internal communication and coordination for the deployment team, but then also obviously we need to respond to all the information and communication needs of people affected and people staying at this module or at this care facility. We also have everything done shelter, basically tent solutions where people then, we have up to 300 tents, 16 people per tent. We have multiple mobile kitchens for the preparation of food, all the wash facilities, so sanitation, hygiene, the toilets, the plumbing, everything around that. There is also a part that is concerning health. So we obviously know that also there are needs there. So we have a basic care system there. Everything that's around making sure that people have what they need also with regards to their health needs. So I briefly mentioned the mobile kitchen. So this is just an excerpt from what we're conceptually also thinking about. In Germany, in civil protection, most of the time you deploy very mobile things for a short period of time. But now we're thinking about this module being deployed for up to 1 year, running there nonstop, 24/7, needing space and the things to cook for up to 7,000 people. So that is why we basically moved away from what we knew and basically moved towards, for example, these container-based solutions, where it's basically a modern kitchen standard, and all of the appliances, all of the things are there to produce the food. With that, obviously, the refrigerated containers, storage facilities, massive 1,000 square meter halls for people to sit down and have their food. There's a lot of waste containers, and basically that's just some numbers. So 44 tons of food per week we will easily go through with this amount of people. And so this is basically the conceptual part as an example at the kitchen. When it comes to health, for example, this is something that we are now that we developed and are continuing to develop. So we have mobile care facilities that can quickly be deployed. You hang them on a truck, you bring them somewhere where they need to be, and it's basically a mobile office, doctor's office with everything that is the German standard, where you can do treatment, examination, some small and minor things. There's a pharmacy, there's a ward, there's a nursing facility for up to 52 people, 104 people, sorry. So for elderly, for the for people with special needs. So all of this is conceptually developed and is being tested at the moment. Another very important part, I talked about the self-sufficiency of things. So yes, we need to be able to procure our own, produce our own drinking water, but then there's a lot of wastewater. 5,000 people, 24/7, showers, toilets, food waste, everything needs to go somewhere. And that is where basically an idea, a concept that the German Red Cross is using in our international work now is applied to also our domestic work, and it's basically a wastewater treatment plant that we have built in and that we also already deployed multiple times in Germany, that is working amazingly, and that is basically also part of this module. Again, we try to have everything logistically with us to be able to have this this deployment for 5,000 people and cover their needs. So resources and some numbers. I mean, we are in this pilot phase, so when you think about this whole module in one big storage, you have around 224 containers, 5,000 euro standard pallets, so 250 truckloads full of pallets. There's 200,000 square meters of space required when we build it up, but there's also 5,000 square meters required when you just stock it. So these are big numbers, but it is necessary because of the certain level and that we want to be able to provide the people with.
Yeah, 1 minute left. Okay.
Yes.
Thank you.
So as I said, there's a lot of numbers of consumption as well. So just 550,000 liters of drinking water and wastewater, thousands of liters of diesel. So these are just big numbers, and this is the first time that basically we are working with such a big number conceptually. I've also briefly mentioned the different logistics needs. So just some excerpts here. We need to move stuff. We need to be able to move it when we get where we need to be. And basically, organizationally, these 5,000 people will be split into 4 villages. Each of these sub-modules has their own structure and has their own everything that is needed for these 1,250 people in one. This is one module, and you can add more if you need it. This is just the last slide, and this is an overview about one of these smaller units, 1,250 people, with a lot of tents on the bottom for sleeping, a big one in the middle for the food, and on the left you have everything that is medical. And very quickly, that was it. I think you might have questions. But in general, this is the first time that we are working together in such a big thing, trying for the event of an armed conflict to be able to respond to the needs of 5,000 people that are moving around in Germany and to cover everything essentially and stockpile it in one place. Yes, and that was it. And thank you very much.
Thank you. Thank you very much for your wonderful presentation. So I remember to all of you, if you have any question, write down in the Q&A section, and will be addressed after the webinar. So our second speaker is Daniel Muñoz. Daniel is an emergency medical technician with over 10 years of experience as paid staff at SAMUR PC, but he also contributes as a volunteer specialist in CRV and risk management since 2006. So Daniel, the floor is yours.
Okay, thank you, Paloma. I will share my presentation. And well, first thing I like to say is to credit Paloma Ray, because all the data gathering and in the presentation you're gonna see was done by her, and she put together all the presentation that I'm going through today. So let's explain how SAMUR, which is an EMS and civil protection, interacts or integrate in Madrid. Since the very inception, we've been together. We are only one organization providing both services, the EMS and the civil protection service. And it's even implied in the name. I mean, our name is not SAMUR and Protección Civil or slash. We have a hyphen in our name. That's to join words together, and that's the philosophy of our organization. SAMUR Protección Civil is one unit. We all work together, and we share the same resources, vehicles, facilities, the same protocols. There is only one difference, and it's the color of the uniform, as you can see in the picture down below. The yellow
Daniel,
color. Yeah.
Daniel, excuse me, we are not seeing the presentation.
No? Okay,
No.
sorry. Let me check again. Okay. Can you see it now, maybe?
Yes, now.
Okay. I'm always having trouble with this. I am very sorry. I apologize. So as I was saying, SAMUR Protección Civil is only, as you can see now, the photo on the presentation. The only difference that we have in this unity is the color of the uniform. The EMS wears a yellow uniform, and Civil Protection an orange uniform. The EMS is paid staff, and all the Civil Protection are volunteers. So for those of you who haven't heard of SAMUR or haven't attended previous webinars, I will explain a little bit what SAMUR Protección Civil is. And we're basically the emergency response service, one of the emergency response service of the City Council of Madrid, alongside with the fire department and the municipal police. There could be 4 boxes instead of 3 because the SAMUR Protección Civil covers both the EMS service and the Civil Protection service, as I mentioned. So we're a typical EMS service. We provide medical care in the city of Madrid. On the streets, we work 95% of our assignments are on the street because there is another service in Madrid. It's at the regional level that they respond to household calls. When there's an emergency at home, and there's this other service who respond to that emergency. So we work mainly in the street and public areas, and we are comprised of volunteers and paid staff. More or less 50% of each. We will go into more detail in the next slides. So here some numbers. People like numbers, so here you have some. We are about it changes, but more or less we're 1,000 professionals, over 1,100 volunteers, and we are not hospital-based as other emergency services. So we have 25 stations spread all over Madrid, and we work from there. More numbers is that for such a big city as Madrid, our average response time, I think it's very good. Within 9 minutes, we are anywhere in the city where we are needed. And 2024, we responded to over 100,000 calls. So in order to better understand how the 2 services are integrated into only one organization and how we work, I think it's a very good idea and to go through the history. I think we're going to understand this better by looking at the badges and the years here in this slide. So first thing to mention is that in Madrid, we have an ambulance service since 1875. It was horse-drawn carriages, and the philosophy was just scooping and running with the patient. And well, that was pretty much it. Nothing remarkable until 1989, where the City Council decided to provide a better care for patients and to also transport these patients in an assisted way to the hospital. So they created a work group to create this service in a more modern way, a proper EMS. And after 3 years of study and designing everything from scratch, mainly from scratch, new vehicles, uniforms, protocols, they came out with SAMUR in 1991. By that time, civil protection itself as a service was already created. In 1992, as you can see on the badge here, and only 3 years after the inception of SAMUR, they decided, okay, why don't we put these two services together? I think we will work together as a unit, and that's what they did. Only 3 years after SAMUR was created. So since 1994 or 1995, we have been SAMUR Protección Civil. Just remember the hyphen. We're a unity. We're not SAMUR and Protección Civil. We're all integrated. And since then, we've been evolving. Not just in the badges, you see a couple different badges. But for example, in 2023, we became a Directorate General, which is the highest rank an organization can have within the City Council. So we have a lot of weight now within the City Council, and we're very respected service working together. So as an EMS, we have the typical functions. We respond to calls. We attend medical emergencies, anything from an accident to a gastroenteritis, and we also do the response to mass casualty events in the case that they arise. And we also train professionals and general population in the initial measures to be taken in case of an emergency. And what does civil protection do? What they do, the typical roles of civil protection. Mainly, they make prevention and risk assessment, and they also manage all their volunteers, and they provide all the civil protection services. A typical civil protection service does. And also, there is a very important thing here is the connection with the citizens. They go to school and they train schools, companies, they train and educate citizens in prevention. So where is the integration? The integration or the magic happens here. Our civil protection has some what we call special units, and which are units that provide assistance to the EMS. In this way, we work almost daily daily on many calls. We work together, we follow the same protocols, we use the same materials, the same vehicles, we have the same facilities, but the EMS doesn't have, that's the way it was conceived. We don't have some services, we don't have bicycles, for example, we don't have motorbikes. And these services, I will move forward to this slide so you can see more of the services, special units that the Civil Protection Service has in Madrid. Logistics, CBRN. For example, the CBRN unit is not a part of our EMS. It's a part of civil protection. But we work in all the CBRN assignments. We work together. We follow the same protocols, even though they're volunteers. The heads of these special units is paid staff, but all the members are volunteers, and they work on every assignment daily alongside the paid staff, following the same procedures, doing the same things, using the same materials, using the same vehicles. So we can't understand one without the other. An assignment as an EMS, I can't even imagine an assignment in a highway 4 a.m. pitch black without the logistics, operational logistics team from Civil Protection providing me lightning. Or I don't even understand responding to a fire in a house without our CBRN unit analyzing the air, providing breathing equipment, or making the scene safer. So we work together every day, shoulder to shoulder, and we work following the same procedures. And as I mentioned, civil protection in Madrid, they're all volunteers, and there's no money involved. It's only love. I believe, as a volunteer myself, I truly believe there is a lot of love and enthusiasm and even romanticism in being a volunteer. And I think that helps making this world a better place, being a volunteer. So just in case anyone of you wants to become a volunteer for SAMUR Protección Civil in Madrid, here you have the requirements to become one. It's mainly certificates and well, nationality and passing an interview. An admission test is my personal interview, and after that you can begin with the training to become a civil protection volunteer. It takes around 6 months to become one, and after that you can specialize to become one of these specialist volunteers that work together with the EMS in these special units that we have. So, well, I encourage you to join us if you want. And there is also a very important achievement for us. That's the next presentation. Because we were recognized in 2023 as an EMT1 fixed corp by the WHO. And we are all aware we wouldn't have achieved this without working together. There is no way we could respond to a CBRN or a terrorist attack if we were not working together. There is no way. So we know this achievement, this recognition, is because we are SAMUR Protección Civil all together, EMS and civil protection interacting, integrated into each other, and with movable pieces that can work on both sides. And that's that's a thing we're really proud of. So for us, not only it's a matter of recognition. For us, there are a lot of advantages of being together, of being the same organization. And as I mentioned, we use the same vehicles and same facilities and same protocols. So we optimize resources. We have our capacity is a crossed one. We can interchange things. We can interchange personnel when it's needed. We have a very strong network of volunteers. Some of them are also paid staff that on their free time they want to become volunteers. So that's a very good achievement. And also I think this is a very important thing. Being one organization, even though we provide two different services, EMS, medical care, and civil protection, we only have one image in front of the population. So for a citizen, SAMUR Protección Civil is only one unit, and that's a very good thing. In other countries, I've seen they have different names for different services, the Red Cross, the White Cross, the Green Cross in the same city, wearing different uniforms or having different procedures. Here in Madrid, we are only one, and that's the perception of the public. And I think that makes us stronger because we're only one, and that's the perception of the citizens. So I think even though we're very versatile because we're able to do a lot of things from civil protection, some risk assessment, or responding to an emergency, we are only one in front of the people. And I think that's a very good thing of being integrated. And also a very good thing is, even though we are volunteers and paid staff civil protection, and EMS, as we are only one organization, we only have one set of values. We share the same vision. We have the same mission, and our purpose is the same. So, in fact, even being two different services, we share the same values. And I think it's also a very good thing of being only one. And well, that's pretty much it. You have my email down below here. In case you have any questions after the presentation, feel free to contact me, and I will be glad to help you with anything.
Okay, Daniel, thank you for sticking to the time. And now we are going to our last speaker. He's Lotenzo Massucchielli. Lorenzo is a humanitarian professional with extensive experience in international emergency response, disaster risk management, and civil-military cooperation. He is head of the International Emergency Unit of the Italian Red Cross. Lorenzo has contributed to major international operation, EU-funded projects, and high-level coordination platforms, combining field expertise with a strategic vision. He holds a deep commitment to principal humanitarian action, innovation, and building effective partnership across sectors. So, Lorenzo, go ahead.
Thank you, Paloma. Thanks a lot, Michelle and everybody, for giving this opportunity. So this is a quick overview on the emergency medical service and civil protection related to what the Italian Red Cross is doing within the Italian civil protection system. So in Italy, the system is quite structured and it works more as a coordination platform of different, we call it operational structures. So firefighters, armed forces, police forces, National Health Services, and the Italian Red Cross. So as part of the emergency management system in the country, we have a network of response center structured in different places and some detachment able to respond to different kind of emergencies. The Italian Red Cross is not covering only emergency medical services. It's the major provider in the country when we're talking about the number of ambulances provided, but this is managed at regional level. So when we are talking about the national level, we are more talking about high biocontainment and emergency medical teams or second level advanced medical post that can be deployed or redeployed. Aside that, we are talking about special rescue capacities. So ground search and rescue, UAVs, CBRNE, and some. I will show you in a while. When we talk about the regional capacity, it means that we have agreements between the Italian Red Cross at regional level with the regional response system and the regional civil protection agency on one side. And when we talk about emergency medical service, it means that we have agreement at regional level with the regional health service and the regional emergency medical service provider, also manager. That is in the end part of the regional government or an agency run by the regional government. In Italy, we have a different standard when we talk about EMT, so emergency medical technicians, and ambulances. So you may find different certification processes in one region or another. So what the Italian Red Cross is doing is to have a national-wide unique training capacity for EMT that is adapted to cover more or less all the needs of the different regional health services in a way that our emergency medical technician can be certified by the different regional health services. When we have to respond to a disaster, so when we have to redeploy assets from one region to another, if we're talking about ambulances, if we're talking about rescue teams, we have to have a green light from the receiving region that they can accept the ambulances and emergency medical technician coming from another one. It's mainly a bureaucracy action, it's mainly a communication, but is quite important because without that, they're not allowed to do EMT action and to practice EMT actions in the in their area of operation. So this is one of the elements that has to be considered when we are deploying or redeploying. What we developed at the national level is a number of what we call regional health modules. They are more or less in between a second level advanced medical post and an EMT one that can be used as emergency casualty clearing station, or as or with other different configurations according to the need. Recently, so a couple of years ago, it's been done an investment of about 2.5 million to buy 3 of these modules. And at the moment, we have one of them deployed in Sicily to cover a need of the regional health authority that they need an additional capacity in case of mass casualty incidents. One module is deployed in Rome for the Jubilee, and all the activities ongoing related to the Pope and so on. Particularly for the next few weeks, they will support the youth days in Rome. So, but for mass casual, sorry, for mass gatherings of different people coming from different parts of the world. And the one module is every time ready for emergency response. Aside this, so we call it regional health capacities because are designed to link and to respond to all the different regional requests when talking about this kind of capacity. So it's more or less a system that can be moved from one place or another in the country without having the need for changing big element. Aside the tents and the medical capacity, it is supported by some vehicles. Particularly, every module has a one ambulance. It is a 4x4 ambulance with capacity for high biocontainment and ALS. So we decided to have everything related to high biocontainment because aside COVID, but even before we have an agreement with the Italian National Health Authority, so the Ministry of Health, for supporting high biocontainment capacity at border level and entry points. So, of course, when we are talking about emergency response, we decided to have a unique standard to reduce difficulties. One minivan and a pickup light towers and a command post. So in this way, it's a self-sufficient structure that can be deployed easily. When we talk about national capacity, we also talk about our special rescue teams. Nowadays, we are including UAV, UAS capacity. We've recently used them in Solferino. It's a town, but it's also a mass gathering event of the Italian Red Cross. So in coordination with the regional health authority in Lombardy, we'd use the UAV to support the identification of the understanding of the situation. So it's supporting situational awareness for them, and for understanding a little bit better how to mobilize and to transfer and to move ambulances, ground rescue teams, motorbikes, and so on, having a better overview of the real-time situation. We have water search and rescue, and of course, they need to be the REMT trained for operating in both in open water at sea and in flood response, according to their subspecialization. Ground SAR and a little bit of support of urban search and rescue dogs, and the rescue dogs conductor is an EMT, and the CBRNE capacity, where according to the different agreement, for example, in some autonomous provinces or regions, like for example in Bolzano, there is a permanent agreement with the emergency medical service to deploy the CBRN decontamination structure as a secondary and health decontamination system to support the clearing of the patient. And I mean, we have the Alps. We have not only the Alps, the Apennine chain. We have different situation where the snow is quite present. So we have a team that can be used both for supporting the classic sporty activity on the mountain skiing around, but also to be deployed in case of heavy snow, in case of emergency response. And in this case, they can be used as both for assessment or for direct rescue. For international response, we have a little bit of readapting things in the sense that we still can use the regional health module as defined, so not certified yet, EMT1 in two configuration. One is light. The second one, it includes another kind of module. We have 4 of this that can support light biocontainment capacity and can be used as in different ways. I mean, it can be used as a ward to support, for example, a ward of a hospital that is damaged. Somewhere for as the EMT1 or as a triage post or ambulatory. That's a little bit how we can change the internal configuration. But it's completely self-sufficient also in terms of toilets, water, and of course the logistic of the personnel deployed and of the patient in case we need to provide food, meals, or other. Of course, we work in different international projects, also deploying EMTs, EMS in exercises. The last one has been done in Albania 3 months ago in a European project named Flood North Alb, where we had deployed water search and rescue teams and having interaction between the different organizations, not only technical rescue, but also medical rescue capacity. So aside and last but not least element is a training. For having all the system up and running, we need to have national and international exercises. So both projects and national activities are quite fundamental because we need to keep the interoperability at national level quite high. So in the last 4 years, we had more than 2,000 volunteers trained in this kind of actions. So in more or less 6 big or full-scale exercise. Plus we have, of course, tabletop and other. But the point for us is to really keep the interoperability checked and tested, and then to develop new kind of system innovating materials, innovating vehicles, innovating capacities within, of course, the boundaries of the mandate and the boundaries of what our EMTs can do according to the national and regional regulations. Thanks a lot, and I'm open for any questions according to the rules of this workshop. Thank you.
Okay, thank you very much, Lorenzo. So, thank you to the three speakers for your presentations. I see that questions have already been asked in the chat for the German speaker and have been already answered. We have 5 minutes in case anyone would like to ask the other speakers anything else. So go ahead.
Paloma, there's one question in the Q&A
Let me
to
check.
Lorenzo. The question is the high biocontaminant vehicles planned to be used for patients with Ebola or else?
Ah, okay. I didn't see it. So, Lorenzo?
Is he gone now?
Lorenzo, are you here?
He's gone.
So, any more questions? Yeah. Okay, if there are no further questions, we can conclude today's webinar. Thank you for participating, and we hope to see you in future webinars. Those of you who will be joining the expert panel, please stay connected, and we'll begin in a couple of minutes. For the rest of you, have a good evening. Thank you very much again, and see you soon.